Hi, everyone. A very good evening to our audience today. Thank you, first of all, for taking out time on a busy Tuesday for being with us here today. So, as Empower has been coming up with unique themes to discuss for people living with diabetes, today we've come up for the first time a topic which is unique, very less discussed, and yet so important for a person living with diabetes. So, today's theme is oral health challenges and how do we manage this for a person living with diabetes. So before we jump into the session, I'd like to share a bit about what exactly is Empowered T1D and how with tie-up we collaborate on events related to looking after people living with type 1 diabetes. So Empowered T1D was put together by a group of enthusiastic clinicians who realized that there is a gap in the healthcare system and we need to really disseminate structured education for looking after people living with type 1 diabetes. So Dr. Amit Kumar De, Dr. Manisha Gupta, Dr. Rutul Gokhilani started this group. They co-founded this group and invited people living with type 1 diabetes to join this initiative so that every month we can come up with interesting themes for webinars and connect people living from every part of India, but also anywhere around the globe. So structured education and continuous learning is basically the theme of Empower. So this is a collaborative effort with tie-up, and tie-up is India's only type 1 diabetes focused conference. We meet annually to discuss more science as well as we include lived experiences at tie-up. So with this, I welcome all our esteemed speakers who are experts in their field of dental care, oral care, and periodontal conditions. And we'll go with their introduction and a very, very warm welcome to our panelists. So today we have Dr. Dominika from Poland. Thank you, Dr. Dominika, for matching up to our India time. Dr. Dominika is not only a dentist who has special interest with periodontology, but she has been a speaker and participant for various diabetes and dental conferences all over the world. She's graduated from Warsaw, and she has many awards and scholarships to her title. She graduated from King's College London, and now she has her global experience in strategy execution and research, and she has amazing, excellent organizational skills. She is also a person living with type 1 diabetes, so we are looking forward to hear from her how she brings her lived experience to today's panel. And we have Dr. Anurag. Dr. Anurag is a BDS, MDS, PhD, also a professor in the Department of Periodontics. He is an expert with oral implantology at the Institute of Dental Sciences, Shiksha Anusandhan University at Bhubaneswar, Odisha. So Dr. Anurag is an ardent researcher, and he has over 100 indexed publications with close to 850 citations. And these are consecutively featured in the AD Scientific Index by Stanford University. We're very excited to hear from you, Dr. Anurag, with all your deep research and knowledge. I believe you're also serving as a professor in the Department of Periodontics. So I think that will be your expert area. And we look forward to having you today with us. Going on, we have Dr. Poonam Jadhav. Dr. Poonam is a consultant dental surgeon at Dr. Poonam's Dental Clinic Indore in Madhya Pradesh of India. So she has been practicing for the last 14 years, but not just the dental area. She's also a certified diabetes educator. What is amazing that she has been herself living with type 1 diabetes for the last 31 years. Yet another lived experience expert on our panel today. Look forward to having your insights, Dr. Poonam. With this, we'll have all our speakers share a bit about how they feel about today's session, and then we go on to chat with each one of you. Dr. Dominika?
I think I should say Danyavad for the invitation. It's a pleasure to be here and share this session with you. As Ree said, I'm a person living with type 1 diabetes since 2018. So now it's going to be my 7th year living with the condition. And I'm also practicing dentist in Poland, Warsaw, and it would be a pleasure to share my lived experience with you tonight.
Wonderful. Thank you for the dhanyavad. Back to you. Yes, Dr. Anurag.
Yeah. You, Dr. Modi. Actually, I'm excited to be here today to share my experiences. And amazingly, I have on my both flanks two dentists who are themselves living with diabetes. That's a wonderful experience. I've met Dr. Dominica and yet to meet Dr. Poonam. Now, we seldom talk about it and read a lot in the literature. And when it comes to our experiences, what we transfer to the patients, that matters. So I hope sessions like this are importantly broadcast and patients also see this so that they can be helped and on this very less talked about topic. So I hope we do a good job here in talking about it at length with our friends today. Thanks for this session and thanks for inviting me. Thank you.
Thank you. I'm sure we'll have a great session.
So very good evening, everyone. Thank you, Riddhi, Team Empower T1D and Tie-Up. It is a great pleasure to be here for a session that brings attention to a topic that is very less talked about, but it is both medically important as well as deeply personal for many of us, that is diabetes and oral health. So whenever we talk about diabetes, we mostly talk about the blood sugar levels, diet, insulin, and complications like heart, eye, kidney, but never or rarely about the oral care or the oral complication, which is very crucial and which is very critical yet often overlooked. So today we'll be discussing upon the oral complications, which is proposed to be the sixth complication of diabetes, that is periodontal diseases. There are many researches that prove the bidirectional relationship or two-way relationship between diabetes and periodontal health. So let's dive in and take a step forward to better oral health and diabetes management. Thank you. Over to you, Riddhi.
Yeah, thank you for being with us today. And I think we deliberated on, this choice whether to have slideshows and a structured presentation or a candid chat. I think the chat is going to be great because, we need to hear from all of you experts here. Like what do you think about this whole theme? So I think I'd like to begin with Dr. Dominica. And this question is for you. According to you, what are the main oral health challenges that you think that people with diabetes face often?
So I think that there are quite a few of them. To start with, the most common is periodontitis, which, as Dr. Poonam mentioned, is considered as a sixth complication of diabetes. But apart from that, we are facing the other oral health challenges, which include also caries, dry mouth, erosion, fungal infections, but also the delayed wound healing. And on the top of that, lack of understanding from the dental professionals as well, because there are not many dentists who have diabetes themselves. And as you know, we've learned about it in the dental school for sure, but it's not covered to the extent that we, the people with diabetes, live and understand.
Right. So I think that is very important to understand. Like, I think a lot of, dental experts may not really be able to envisage what a person living with diabetes goes through. So while they may have the knowledge, some of these real experiences is what we are trying to bridge the gap here. So this one is for Dr. Anurag. Do you think we have enough awareness around the diabetes and oral health connection? Is it adequate as of today among the patients? And how do you think that oral healthcare professionals can educate the patients or people living with diabetes, about this connect?
Speaking about the awareness, if I draw a line or a platform, I would step 2 steps down rather minus in case of awareness. What I mean to personally say is that uh, generally patients who have diabetes with themselves, they are totally unaware that there is a component of oral complications. They are mostly concerned about the lifestyle. They are concerned about the other organ failures, but this can affect their gums. This can affect their oral health is very less known. So the awareness is very low. Not only that, I would like to go ahead and say that the awareness is also, although our medical counterparts know that, but the transfer of information to the patients who have diabetes is also low. So probably when it comes to the seriousness of a retinopathy or the renal failure or patient diabetes having a complications with other organs is concerned, they are very particular. But probably this area of oral health is neglected. They do not adequately educate the patients enough that you also need to go to a dentist and you need to get your oral health checkup done. Having said that, how can we improve this oral health? So, as oral healthcare workers, we must ask this question to each and every patient that whether they are suffering from diabetes or not. And not only that, we should go a step further that to know what kind of medications they are taking. Sometimes we take a history that yes, the patient has diabetes, we record it, then we go ahead. But we must take a step forward, like what kind of oral anti-diabetic drugs they are taking, or if they are T1 diabetic, whether they are taking insulin or not. And most importantly, is their blood sugar under control? So what is their current HbA1c level? We should be asking, and also to educate them in terms of maybe an infographic or a visual representation that inflammation and dental diseases are related, and maybe keeping some flyers in the waiting hall area where they can go through it. So these information helps them. Nowadays we are living in an age of digital world where social media has a very good impact. So social media also can be used to have these small informations like reels and stuff like that, where we can educate our patients about awareness. So I think awareness has a long way to go, and all of us are partners in that. And today's program is also a step in that direction. So both the patients who are living with diabetes and also our counterparts who are in the medical profession, both we should work together in order to talk about it more and more. That is why.
Right. Yeah, I think you're so right, because I think at the point where a person is consulting a diabetologist or an endocrinologist, I think in that list of tests, we get so overwhelmed. And obviously the other organs, they get high priority, but most often oral care is missed out. And I think that's the gap which I think diabetes educators are trying to fill. And I think when we go on to Dr. Poonam, she's smiling already. I'm sure she's going to add that, because I think that is where we need to really nudge people who are talking to us to say, every time you go get all your checking done, make sure you include oral health in your list of things to do, because it's so important. And very often this is just something that came to my mind as Dr. Anurag was sharing, that when we are trying to stabilize our insulin basal bolus regimes as children, very often, or even as adults, whenever we are going through a overnight hypo or a night drop, and we are just popping hypo tablets, and the first concern that comes to our mind in the morning is that all these glucose tabs that we are having in the middle of the night, we are not waking up to brush our teeth. So how is this going to impact in the long term? But yeah, thank you, Dr. Anurag, for sharing this. And I think the next question for Dr. Poonam is that can diabetes-related oral health problems serve as an early warning sign when we are trying to diagnose diabetes? Like, what is your take on that?
Yes. So it's an absolute yes. So whenever a patient comes to our clinic, the very thing we see is the gums health at first, then caries, and at times it happens that people with long-term undiagnosed diabetes develop gums disease or periodontal disease, where there is loosening of gums, swelling, inflammation, bleeding, and patients are unaware that they are having an underlying disease which is a result of this gum problem. So whenever a patient comes to me at the age of 40, 50, 45, though we have patients of less age and higher age, but this is in this middle age, people often have diabetes and they are not aware that the underlying cause is diabetes, and people become completely edentulous. I have seen in my career that they have lost all of their teeth because of underlying periodontal disease that is a result of diabetes. So these are the early signs, and in fact signs and symptoms that a patient may tell you, and we also can examine at the time when patient comes to us. At times patient tells to their physicians or the diabetologist or endocrinologist that I have a problem of bad breath, that is halitosis, persistent bad breath. So it is a very common symptom, and at times the family or the friends of that person can notice and tell them that you have a problem of bad breath. So it is a very common symptom among the patients. Then another is dry mouth. So in long standing diabetes, people have less saliva production, and as a result they can have, because of dry mouth, because saliva acts as the lubricant, and because of that people can develop caries, can have a lot of tartar in their mouth, plaque in their mouth. So whenever a patient comes to us on taking the history, they are not aware, and I directly ask them to go for an HbA1c, which is the cheapest test they can go for. And on that visit, we can get that person diagnosed with diabetes. Then at times people have oral candidiasis, oral thrush, or we can call it as the fungal infection in layman's term. Fungal infection is very common in people with poor diabetes control. So these are some early symptoms, early signs that we can notice, or the patient himself can tell to their physician. So we need a multidisciplinary approach here. And as patients go for a diabetes monitor every year annually, so in this, a dental screening or dental treatment should also be advised. It should also be incorporated, and it should be taken very seriously, because it is proposed that periodontal diseases are the sixth complication of diabetes, which people are unaware of. This is a topic which is very less talked about. So there are many other early signs that we as a dental surgeon, as oral healthcare professionals, we can work upon that, and with the help of our medical counterparts, as Dr. Anurag rightly said, together we can work on oral health and overall systemic health of a person with diabetes. Because many a times diabetes do not have symptoms that patient gets, but on an accidental visit, when a patient comes for some other reason, we identify that this person has diabetes.
Okay.
So over to you.
Yeah, actually, that's quite an eye opener, because I think prolonged periods of hyperglycemia and dry mouth, we've never paid attention as people living with diabetes who are not understanding the oral expertise area, that, these could lead to what kind of complications when it comes to oral health care. So I think that was very important. And it's also an eye opener to realize that at that point, someone who's undiagnosed can be picked, and we can say that let's get this test done. So it does serve as early diagnosis. So yes, that's very important. And I think about the perio diabetes connection, can periodontal disease affect blood sugar control in people living with diabetes? And in this particular area, Dr. Dominica, what would you like to add in your experience?
So the link between diabetes and periodontal disease is very well established, and individuals living with diabetes, particularly when their blood sugar level is high, are also at a higher risk for developing periodontal disease. And what this means is that elevated blood glucose can lead to, for example, increased susceptibility to infections. So high glucose levels in saliva can promote, for example, bacterial growth, which can lead to the gum infections. And secondly, as I mentioned before, this could also contribute to the impaired healing, and because diabetes can slow down this healing, and this can make harder to recover from gum infections such as periodontitis. And also, hyperglycemia can contribute to the immune response of the body, which can exacerbate the gum inflammation. And also, what's interesting, a lot of studies have shown that people with diabetes are 3 times more likely to develop gum diseases comparing to the people living without diabetes.
Yeah, that's so important for us to know, right? For people living with diabetes, it's very important to keep their blood sugars with better time in range, because over a period of time, we tend to forget that, it can have a multitude of issues and complications. And I think the next question we can just go on to ask Dr. Anurag what he would like to add, especially on this periodontal connect with diabetes. What are the common problems that people living with diabetes are more prone to? And when it comes to treatment options, like how would you differentiate the treatment for a person living with diabetes versus someone who doesn't have diabetes?
Yeah, thank you, Dr. Riddhi. As Dr. Dominica rightly said, that once you have diabetes, it affects your immune system, and there is a consistent hyperglycemia, and it leads to a collagen disease. I mean, there is a breakdown in the body which makes you vulnerable for a disease. Now that has to be understood. On this regard, patients who have diabetes will be more prone for this breakdown. So they will be having maybe gingivitis, that is persist bleeding of gums. And if this is unchecked, this may further to a breakdown of the supporting structures of the teeth and lead to periodontitis, where you would see a tooth mobility, pus around the gums. One of the telltale signs which I have seen among diabetes with uncontrolled blood sugar level is multiple abscesses of the gums. So if you see a patient who has several abscesses, especially gum abscesses in the body, in the mouth, then immediately we should suspect diabetes. In fact, now when I see my patients, if whether it is a periapical infection or a periodontal infection, which is leading to a pus formation or an abscess, I immediately ask the patient about the diabetic history. And with the current trend, where earlier the diabetes was around maybe more than 45 years of age, but we now are seeing diabetes in as an increasing trend among young adults, and most of them are also T1 diabetic. So probably I am asking all of my patients, are you diabetic? And most of the times the patients do not understand this question, because they think, why is the doctor asking me about diabetes? I have come to the doctor for my toothache. So we educate them, and then surprisingly, I think 10% of patient of to whom we ask, they land up with a diagnosis of yes, there is a derangement of blood sugar level. And so as I was saying, that patients who have diabetes are more vulnerable and they are more prone to infections. Secondly, when we treat them, thankfully the treatment does not alter much. It is the same treatment for both diabetics and the non-diabetics. However, we have to be very cautious. I mean, if you have a diabetic, so we have to cover it so that we don't land up in an unnecessarily delayed wound healing, and we probably will have to cover it with an antimicrobial dose. So we will be definitely on guard.
Right.
Another thing that I have noticed is we do talk about hyperglycemia a lot, but we must also talk about hypoglycemia. So for patients who have not been able to manage their blood sugar levels correctly, and also they are very erratic in their drug regime, and if they are on insulin. So I definitely ask whether you have had something in the morning or whether you had something in the evening, because many a times they are dosed, but they do not know that they have hypoglycemia. So I don't want my patients, while I'm performing any dental treatment, to be under hypoglycemia. Hyperglycemia is still okay, but hypoglycemia I don't want. So these are things we always take into consideration. If it is a diabetic, then we make sure that we have at least glucose in the clinic, or ask the patient whether they have had anything with them. As far as the surgery is concerned, definitely we load it up with a covering antimicrobial so as to minimize the potential risk of infections in these cases.
Correct.
More or less, otherwise the treatment remains the same. Yes.
Okay, I think this was a very important discussion because I think that was very sensitive of you to say we do have some sugar handy, while the treatment is going on, because these are often overlooked. And as you rightly pointed out, while we are currently focusing on type 1 diabetes, but the incidence of all kinds of diabetes is so fast rising, that rapidly rising, that, at times even pre-diabetes or young kids who are getting diagnosed with pre-diabetes, they are not even aware. So that's very important to keep in mind, because at times maybe when they enter a clinic and we usually ask them to fill up their medical history, I'm sure at times they don't know,
No,
right? So they wouldn't say
no, no.
that they would have it. But I think when you're actually looking at their, oral condition, then you would be in a far better position to see what is the reality. So
What I mean to say, Dr. Reddy, is that the onus is on us because the patients are unaware, they are uneducated. So
right,
if you make a point to put it across them to ask a question, then the
right,
discussion will start, the dialogue will start. And as far as the treatment protocol is there, I think most of the dental surgeons, they know about it. But hypoglycemia is something that it comes to us as an emergency practice. So we tend to overlook that fact, especially with diabetic patients.
right. That's very important when it comes to the surgical part. Like, it's important to ask those questions, because the responsibility is on us to, look into those finer details as well. Thank you, Dr. Anurag. Dr. Poonam, like, I wanted to just know, how often do you come across people who are consulting you, who are more prone to gum disease or tooth decay with type 1 diabetes? Like, is it often that you see people walking into your clinic who have type 1 as well as, any of these oral conditions? And we would also like you to highlight, what role does regular dental care play in managing periodontal disease? So how has your experience been?
So the number of patients with type 1 diabetes is obviously less than type 2 diabetes. So if I talk about diabetes in general, so there are many patients that I come across in my OPD that people have diabetes, and they most of the times have gums disease or periodontal disease. And before starting, I would like to put a disclaimer that people, those who think that they have diabetes and they will always have periodontal disease or gum disease, is a wrong notion. It's a very a wrong idea, misconception, myth. If you have a poor control over your diabetes, then only you are prone to have a disease, any kind of complication, only when you have a poor control. So having diabetes doesn't always mean that you have something in your body,
Yeah,
because it makes people psychologically disturbed that they have something in their body.
right,
So obviously, when you're hypoglycemic for a long time, you have chronic or persistent elevated blood sugars. Then, as Dr. Anurag and Dr. Dominica already said, that you have a compromised immune response, and only because of that you have gum diseases, you have xerostomia, the dry mouth, and this condition is also temporary. When I am in a state of hyperglycemia for a day or two, or a person is having diabetic ketoacidosis, then you have dehydration, and because of that you can have dry mouth. And because of high blood sugars, there's a high good breeding ground for fungal infections. So it is also one of the conditions. So people are obviously prone to these diseases when they have diabetes. But when it comes to coming to your second part of the question, that how the dental care can help in managing that. So whenever people come to us, we see that what is the condition of gums, what is the condition of the periodontium, and here comes the role of the patient education. This is a very common problem that I see in my clinic. Whenever I ask a patient, when did you last get your HbA1c done or your blood sugar level done? And patient is like, why would I get my blood sugar done, or why would I get my HbA1c done? And it was okay. Once I got it done 3 months back, and it was okay. It was around 100. But here comes the role of patient education. We have to make them learn that your blood sugar level goes up, goes down, and it varies every minute, every hour, and it's certain, many a times in a day. So you have to get your HbA1c checked so that you know that what was your level of blood sugars during last 3 months, and then only you'll get to know that how was your blood glucose control, or you have diabetes, or you do not have diabetes, or you are in a pre-diabetic stage. And once you have diabetes, there has to be a customized dental treatment plan for that person.
Right.
Because as Dr. Anurag rightly said, we need more antibiotic cover for people with diabetes. And when we get the scaling done or any treatment done for a person with diabetes, as compared to the person who is non-diabetic, we need to see the HbA1c or the sugars of that person during that treatment, because it makes your healing different from a person with who is non-diabetic.
Right.
So we need to take care of the underlying blood glucose levels, your HbA1c, until and unless you have a good diabetes control. You won't, any mouthwash, any toothpaste, any medication won't work for you until and unless you have a good control over your diabetes. So dental health obviously helps a lot, and it acts as a early sign, early symptom, early, it's a precursor to your frank diabetes. So all the dental science helps a person to get their diabetes diagnosed during your dental visit itself.
Correct.
That's
So
all.
I think that actually made me think, as you were sharing, it just made me think that for people with type 1 particularly, monitoring is so important, because as you said, like maybe a person would have said that their HbA1c when they got it tested was 100, but that could just be the snapshot of that very minute. And for
Exactly.
type 1, there are so many variations, and throughout the day, they have so many different readings. What we go
Exactly.
through different phases, and we are not able to arrive at what could be even a suggestive time in range. So which is why monitoring is extremely important, because then they can discuss this with their consulting endo or diabetologist on how it can be improved. It can be discussed with the diabetes educator on where they can get help around this. And even if they come to a dental expert, seeing the time and range, I mean, if we ever kind of work this as a very high level multidisciplinary team, if the dental expert can see the time and range, they will get a real good snapshot of how their blood glucose working is. And that's why we are so often pushing and discussing about monitoring. So I mean, of course, the financial aspect is definitely there, but if we utilize it effectively, it can save a person from many more expenses in the long term. So if we have people living with diabetes in our audience today, our strong urge or takeaway from this part of the discussion would be that it would be very, very important to monitor your blood glucose levels and also maintain a good time in range. So if we avoid the consistent hyperglycemic stage, we can avoid a lot of these issues that we could face with our oral health, and the fluctuations can also bring down a lot of other complications. So I think this was a really insightful discussion so far. But
And I would like to add one thing that Dr. Anurag rightly said already. He already mentioned that people who are insulin dependent must also monitor before getting any dental treatment done, because hypoglycemia is one of the life threatening medical emergencies, chair-side emergencies that happens in clinics most of the time. So it is very important to note that what is your blood sugar before getting a treatment done, before starting the treatment, because the dental appointments usually takes half an hour or 45 minutes in one sitting. So take along with your glucose, your hypo tabs, your sugar supplies, your hypo supplies every time with you for type 1 or any person who is insulin dependent, because there are many people with type 2 diabetes who are insulin dependent these days. So this message is for all of those
correct.
people.
Because I think sometimes we overlook the type 2 diabetes people who are on insulin.
Exactly.
That they will face the same issues with hypoglycemia. So very important point.
Right.
Anurag also wants to add something.
Yeah, I just wanted to add here that this is a prevalent practice among the patients which we come across, that when we ask them that are they diabetic, they said yes. Then I ask them, are you taking medicines? They say, yes, lete the, now we don't take. Now that's very surprising. Why? The answer is they think that their diabetes is under control. This is very dangerous. I mean, because there is no culture of monitoring blood sugar level. Now, titration of diet, titration of your drug regime, what they are presently having, probably there is a misconception. Also, there is less education that there are a lot of naturopathy, there are alternative medicines which will cure their diabetes, and this is dangerous.
Right.
I mean, I'm okay with all the other modalities. However, it will boil down to the blood sugar level. I mean, we must monitor our blood sugar level and HbA1c, and also now we have continuous glucose monitoring. Now, these are tools which are helpful for us, and I think I would say here that many of our patients are not aware, they are not trained, and there is a need for diabetic educators. It was also news to me that there are diabetic educators, and I strongly propose that diabetic educators should be more upfront, and people do not know that there is something called diabetic educator. Both the clinicians as well as patients must know, and probably we must also recommend to the patients that to clear these myths, who are thinking that their diabetes is now cured, they don't have any problems, but about the spikes. They don't know about the long-term complications. They just think that they are currently feeling well, so it is all well. So I think that's a very dangerous situation, and there we pitch in. And maybe one of the important aspect is how do we manage in addition to our treating and the help of our counterparts diabetologists. Now we must work together, and only when we work together, then we can do it well.
Right. I think it was very important to bring this perspective as well, because for people living with type 2 and on insulin, very often they just stop their medication on their own because they believe that they are fine. So I think it's very important to keep on regularly pushing them to, visiting their endo so that they are in constant check. Many times these alternate therapies also make it a little more complicated because they just resort to these on their own. And then we realize that after the complications start showing up, we realize that it has been a very long gap of no correct medication and no advice from an expert. So it's too late then to make corrections, or, already a lot of damage has been done. So this is a very important aspect for people living with type 2. And I think from the multidisciplinary approach, we should all try to push and make sure that there's continuous, follow-ups in these cases. So I think now, we are all aligned on, how we can diagnose, how we can prevent, and how we can treat to some extent. But here's what I would like to bring to today's session, is a little bit more about the lived experience. And with this, for Dr. Dominica, I would like to ask, like, how often would you recommend that a person living with diabetes should consult a dental expert? And when they do schedule an appointment, what would you recommend? Like, how would they be prepared? So I would just like to request the tech team to, just help us with the supporting document. And over to you, Dr. Dominica.
Thank you, Riddhi, for this question. I think it's very important. I also believe that there is no one straightforward answer regarding that, because every individual living with diabetes is different, and it's up to their dentist to assess their caries and periodontal disease risk. And that would really answer your question as to how often the person with diabetes should visit their dentist. However, I should say that, in my opinion, it should happen at least twice per year to get things under control. And, it's better to prevent rather than cure. So we as a dentist really aim to prevent any kind of the consequences that could happen from the complications of diabetes, periodontal disease, and caries. In terms of your second question, with my colleagues with whom I'm running Periodontitis Diabetes Hub, we've actually prepared a document which is dedicated to the person living with diabetes, and it includes every single information related to what a person with diabetes should take to their appointment, or about what kind of information they should provide to their dentists. I think what's the most important is the information related to the hypoglycemia. So if you're a person living with type 1 diabetes and you have hypoglycemia unawareness, this is one of the most important things to be mentioned to your dentist. As well as the fact that you should have an access to be able to check your blood sugars from time to time. I think that this makes dental appointments definitely less stressful for both sides.
Yeah, I think it's important to go prepared, knowing what to expect, and also to keep your blood sugar levels in a good range so that we can avoid surprises as far as possible.
Exactly. Of course, it's also very important to mention your HbA1c or what kind of time in range you have, but I treat this as basics and they are all listed in this document, so I highly recommend to read it.
Right, perfect. And with that, like, do you see that, people who consult you, like, do they follow the twice a year, like, regularly for seeking the appointments? Or do you feel the need that we need to remind them often? Is there...
To be honest with you, I think that depends upon the personal circumstances, because sometimes, even though people are really willing and they obviously remember about these appointments and they are willing to attend them, they are just unable to afford them. And that's the other matter which we should consider, that sometimes it's not that easy to get access to the dentist.
Right.
And it happens everywhere. I was working in the UK and now I'm working in Poland. So we also have to take this into account when we are seeing the other person.
Right. I think it's a very personalized thing for everybody. But yeah, definitely the cost and the affordability is a concern wherever you live, no matter where you live, right? It's an added cost to your treatment and management. And like, do you feel that there are certain use of products which you would recommend in your daily management, like certain which could be like mandatory, that this is something which you must do? Is there something you would like to add to that aspect?
So I would have said that for people who have a higher risk of caries, it might be beneficial to use a toothpaste which contains higher amount of fluoride, but it's best to consult it with your own dentist to what kind of concentration fluoride you should apply. And secondly, I would have said that it's very important to rinse your mouth with water after hypoglycemia at night or a mouthwash, just to conquer the acidity of the ingredients we've consumed to treat our hypoglycemia.
Right. I think that's very important. Like many a times, out of panic, we just treat the hypo and that's it. But this is a
But
very,
we're also tired.
just like we often neglect the dental care, this is again part of the same thing that we need to get up and still rinse our mouth and then go back to sleep. It's tough, but we got to do it. So, yeah. No, thank you for those insights and, what to do before the appointment. So we have the next lived experience expert here, Dr. Poonam. How has living with type 1 impacted your own oral health? If you have any experiences to share. And like, how do you personally manage your oral hygiene along with your diabetes care?
So thank you, Riddhi. As a person with type 1 diabetes, my oral health was quite good right from my childhood. But when I was, 15, 16 years old, I had brittle diabetes, and I was diagnosed in those times when the insulins were not that good that are there in today's times. I was on Mixtard, and my HbA1c for 1 or 2 years it was around 8, 9, 10. And during those times, I had gum infections twice or thrice. And I still remember the words of my dentist. He said that getting an infection once a year, you can have antibiotics once a year, but not more than that. But as I grew up, as I read dentistry, I learned my diabetes management. I improved my blood glucose control. The incidence of gum infections reduced a lot drastically. And I would say I never had any oral complication because of my diabetes, because when I had a good control, there was nothing like that. And what I personally do for my oral hygiene is I brush twice daily, which I advise to almost all my patients, whether you are diabetic or non-diabetic. You should brush your teeth twice daily. Morning brushing is a very is a habit that we learn right from our childhood, but night brushing is mostly skipped by many individuals because of lack of awareness. And flossing is another important, which we should complement with our brushing. And at times you can use an antimicrobial mouthwash with the supervision of your dental surgeon. I always say this to all my patients, that do not change or do not use any medication, any mouthwash, any toothpaste without consulting your doctor. And once your doctor advises you, do not use it for indefinite time. Always ask your doctors always tell you that for this duration you have to take, but patients take it for for indefinite time. Do not do this, please. Whether it is a mouthwash or toothpaste, if a doctor advises you to take it for 1 week or 1 month or 3 days or whatever is the duration, stop it after that. So once in a while, you can use any antimicrobial mouthwash. You can use any toothpaste that strengthens your gums. So all of these practices you can follow for your oral care. And there is one myth, one misconception among people with diabetes, that with diabetes you cannot go for any dental treatment. This is a question that people frequently ask to me, whether we should go for a filling or not, whether we should go for a scaling, root canal, or extraction. Our dentist has advised us this, but is it prudent to get this done or not? So if you're having a good control, there is no issue in getting any dental treatment done. And if at all you have a poor control, you should consult your endocrinologist as well as your dental surgeon. Both the things should go hand in hand. And after having a good control over your diabetes, you can have a dental extraction. You can have a RCT that it has nothing to do with your blood glucose levels. You can go for scaling. You can go for any dental treatment. Even I had got my one of my third molar extracted. I had an antibiotic cover. I was given antibiotic for 11 days. I still remember. But this doesn't mean that you cannot go for any dental treatment. So have a good control of over your diabetes, and you can have a good oral health as I do. I do not have any oral complication because of my diabetes. Yeah, that's all from myself.
So the base level, we need to manage our blood glucose levels. That is
Yes.
everything, the foundation of everything.
Exactly. No mouthwash, no medication, no toothpaste will work until and unless you have good levels of your blood sugars. That is the key.
All those other things are only supportive, but the foundation needs
Supplements. Yes.
and that is the blood glucose levels. And this is again applicable for any kind of diabetes. So that's a very important message. And also sometimes, like, we all know it, but we forget or we just become negligent. So these are good reminders to say flossing is important, brushing twice is very important, and continuously looking after your oral health as much as you do for anything else, right? So that's an important one. And it's good
And
to
incorporate dental health checkup in your annual health checkup.
Right.
Dental health checkup is as important as your systemic health checkup. So always have a dental checkup along with your diabetes monitoring, annual diabetes monitoring.
Yeah. So I think we need to put that as a another to do in the same list so that it's taken care of at the same time. And I think it's important that as we evolve in our journey with diabetes, we get to understand that better insulin is available, better monitoring is available now. So we must urge other people to use it as much as possible. Much better technology is available. So as far as possible, if we are at it, there's very little chance that, we can go wrong. But just to identify the signs and symptoms, I wanted to ask Dr. Anurag, is there something that you would point out to as a symptom to look out for if somebody is having a periodontal or a gum disease? And now somebody had just asked in the chat box that some of the diabetes, some of the people living with diabetes do get frequent infections in their gums. So how do we identify it and how do we avoid it in future? So
Okay, thank you. I think I should thank Dr. Dominica to have put out that document. It's an excellent document, and I hope the audience will take a screenshot of that. So that summarizes most of the thing. And Dr. Poonam to have said that nothing will work if your blood sugar is not right. So that's right. There's a myth that with diabetes we are going to have an infection. That's not right. There are many diabetics who have no oral complication, they have no gingivitis, they have no periodontitis. The reason is periodontal disease is a multifactorial disease. It is primarily microbial, but it also depends upon the host response. So how the host responds, that is very important. Having said that, how do you identify the disease as somebody asked? Now, among all the diseases and the oral signs and symptoms that I know of, one telltale sign of a diabetic is multiple periodontal abscesses. This is something that I have seen that it is most often associated with a confirmed diabetes, and not only confirmed, uncontrolled diabetes. I would repeat that if you see pus in the mouth, again, if you see pus in the mouth, you should ask for diabetes. So that could start as a bad breath, that could start as a bleeding gum, that could start as a spacing among the teeth, that could start as a you can say receding gums or the lowering of the gum level. That all these signs. And how do we know about that? The answer to that is visit your dentist. Many times we feel that we are experts, we know that everything is all right. The fact is, even if we have bad breath, we ourselves will not know it because our olfactory senses are toned to it. The person sitting next to us knows that you have a bad breath, but will not tell because you will feel embarrassed or you are a boss or something like that. So the best person is to go for a dental checkup. And if you have a habit of once in 6 months to have an oral health checkup, that is good. Now for diabetics, I would recommend that this can be shortened to 3 to 4 months. And it may not be anything. It may not be just a casual checkup. You develop a rapport with your dentist or the oral health care provider that I have come, that there is nothing which has gone wrong, because the oral glucose level or the blood glucose level can shoot up and it can be deranged, and it takes no time in showing it up. And the most common telltale sign is the oral complication as an abscess. So that needs to be taken care. Now, when we come to the managing such cases, as many of us have pointed out, we need the help of diabetologists. And not only that, we need to get it in writing that how they have been managed, and wait for an elective procedure which can be deferred. Then now there are two kind of treatments. One is an emergency. In all hospitals, there are patients who are diabetics and they are being treated. And they are being treated under heavy dose of antibiotics. We don't want that. We want that the patient should maintain the blood glucose level so that we can treat them normally. To do that, we must revise the diabetic control. It might need an alteration of drugs. It might need an alteration of insulin regime. It might need an alteration of diet and exercise control. But whatever it may be, it may wait for 2 to 3 months if it is not an emergency, and then turn it as an elective treatment and then manage, so that we get a better tissue response and a better healing.
Right. So I think this brings us to kind of summarize that, there are immense benefits in having an interdisciplinary care for patients with periodontal disease and any kind of diabetes, because it's not something that one person can handle or one expert will be able to help you with. So if the dental expert is observing these, he can give a little bit of a nudge to the treating endocrinologist to say, maybe we need to look into the time in range or managing the blood glucose levels better, or how can we correct some of the areas where the person is going wrong. And, wherever those loopholes are, like, we need to plug that. So how often do you think, Dr. Anurag, do we have these, multiple levels of people or multiple skill sets getting involved? Do you think that in India, we need to work better to get interdisciplinary care?
I'm very sorry to say that we don't have that.
Yeah.
And it has been an endeavor, and from our side, in order to reach out to our medical practitioners, especially not only diabetes, any medical practitioner, because the diabetes do not land up to diabetologists directly. They land up to any medical practitioner. They can be general practitioners. But the thing is, the dental part, which is knowledge which is imparted during the MBBS and maybe MD, is very, very less and probably overlooked majorly. So I think a little brush up can be done to identify the oral signs and symptoms. It does not take much. It just needs a torch and peep into the mouth if they can see something. And definitely recommend a referral to a dentist. I strongly request my medical counterparts to recommend a dental visit and only see the patient if they have gone through the dental visit in the next visit, because that will break this monotony cycle, and that will also bring about the seriousness of the matter. See, if a dentist is asking that please come for a oral health checkup, you might think that the dentist wants to earn some money, so he's calling again. But if the diabetologist is saying that I need to see you next time only when you have an oral health checkup, that is a little more serious, and I value that. So this is how we work. We work as a team, both communicating with each other, both identifying the early signs and symptoms, because we want to catch them early. We don't want to land up into trouble, into complications. And at the end of the day, we want the best quality of life of our patients, so that they can not only manage their blood sugar level and the diabetes control, but also they can manage their oral health. The research says that it is a two-way relationship, as Dr. Poonam was saying, that not only uncontrolled diabetes will lead up into a periodontal problem or oral health problems, but even if you maintain your oral health well, it will help in good diabetic or glycemic control. So we work hand in hand, and this is how we work. Probably a policy or maybe a tool checkup in every health checkup in corporate hospitals or in any hospital, before any surgery, before any major treatment is done, there is a checkbox where it is written oral health checkup. So if that is done and seriously practiced, we will definitely catch them more and treat them better and prevent.
So I hope that from today's session, a lot of us go back taking this insight to say that if you're a treating endocrinologist or a diabetologist, definitely have that tick box, even if it's at the end. Like you do your retina check and all the other tests, but definitely have that check box for oral health and nudge them so that they don't come back without having regularly visited the oral health expert. And I would also like to know, how are things in Poland, Dr. Dominika, like in your experience of practice, from the awareness part and also the support from the diabetologists and endocrinologists?
So in Poland, when it comes to dentistry, we have a private as well as a public health system. Although I think from my point of view, this is the subject which still needs more awareness and underscoring among the patients, but also among the diabetologists.
I think so. We need more experts like you all to attend our diabetes conferences. And, there you get to meet different experts, doctors, as well as people living with diabetes, as well as diabetes educators, so that we can actually discuss the agenda and, work together on this. But with this, we've had an amazing 1 hour. I didn't even realize how time flew. Some very engaging discussions, some wonderful insights. And personally, for me, as someone living with type 1 and also being a diabetes educator, I think I will go back with very, very important messages. One being improving my own oral health care, being a little more regular about, following the rituals. Even if the blood sugars are in control or well managed, I think, looking after your oral care is very important. Secondly, as a diabetes educator, to continuously remind people who are discussing with you, whether they are children, young adults, or grown-ups, we need to remind them about their regular visits. And whenever we interact with clinicians, to urge them going forward to make sure that we give the right priority to oral health care. So I think with that, I'd like to give each of the speakers a few minutes to sum up and give like one key takeaway before we, and wrap up today's session. Any of you can just start.
I can start.
So I would say, yeah.
Go for it, Dr. Punam.
No, Dr. Dominika, please.
Okay, thank you. Yeah, so I think my only takeaway from that for the people with diabetes would be to remember to rinse their mouth with water after every single episode of hypo, as this simple habit could really significantly improve the quality of their oral health and maintain their oral health for longer.
Thank you. Yes,
Dr. Poonam.
Yeah. So I would say the mouth is the gateway to the whole body, and oral health is not about just bright smiles, but it's a key component to overall health in people living with diabetes. And with all the conversation today, you would have understood that oral health is not optional, but it's essential. Regular dental checkups, brushing twice daily, flossing, blood sugar levels maintenance, all of these things go hand in hand. And for having a good overall health, you need to maintain all of these parameters, and by this you can have a good quality of life, a wonderful life even with diabetes. So get your dental checkups done, stay healthy, keep smiling. Thank you, Dr. Anurag.
Yeah, thank you. I think I would say that oral health is something that we we start our day with. When we wake up in the morning, we go up to our washrooms and see ourselves to brush. So first and foremost, my request is to all my patients and all those who are living with diabetes is to see themselves in the mirror while brushing. This is a very important thing. They don't even brush while seeing it. So see what you brush, number one. Number two is that it is just a condition and it needs to be managed. So, and we are together in it. You are not alone. And we want to see you not only with brighter smiles, as Dr. Poonam said, but with healthy smiles. So this healthy smiles is also a burden on us, is that we want to work together in order to get a very good quality of life. And we do not know it all, and we must approach without any hindrances to the nearest doctor, nearest educator to ask anything that we like. If we do not ask, if we think we know, that is where we are making a mistake. Please approach and ask and go and walk this journey together with all of us. I think that is what I would like to communicate to you.
Yes, wonderful. Thank you so much for these amazing key takeaways. I think everything has been so beautifully summarized, so I don't really need to add anything. But recently I attended a conference, and this is a quote I heard, and I think it's so befitting to talk about it today. That diabetes management doesn't have to be distressful. It can be delightful as well. So I think with amazing panelists like the three of you here, it is definitely looking delightful, and added to it, if the oral care is done optimally, then there's nothing that we really need to worry about. And I'd really like to thank all our amazing speakers today for sparing their valuable time for this topic. I think we've had an amazing, engaging discussion. I hope the audience will go home with, like a better mind state, and, not neglecting their oral health care, but also look at it more positively. Like Dr. Anurag said, first thing you wake up in the morning, you can look at yourself. So wishing everyone in the audience balanced blood sugar levels and happy smiles. And with that, we wrap up today's session. Thank you all the speakers. Thank you to the audience for being here, and also to Team USV for enabling this amazing, seamless session and always supporting us from the back end. So thank you very much, and good night, good evening, whichever.
Thank you, Dr. Riddhi. Thank you, Dr.
Thank you,
Dominica, and
thank
Dr.
you,
Poonam.
Riddhi. Thank you, Dr. Anurag, Dr. Dominica. Thank you, team.
Thank you.
Thank you, faculties. Thank you, Riddhi.